Hey, welcome to this video. We will talk about metabolic syndrome. So, what is it? The World Health Organization defined it as the presence of insulin resistance in addition to two of the following risk factors: obesity, hyperlipidemia, which includes hypertriglyceridemia and low levels of high-density lipoprotein cholesterol, hypertension, or microalbuminuria. In other words, it's a cluster of metabolic abnormalities that includes hypertension, central obesity, insulin resistance, and atherogenic dyslipidemia. And what are the causes? Many contributing factors and mechanisms have been proposed, including insulin resistance, adipose tissue dysfunction, chronic inflammation, oxidative stress, circadian disruption, cellular dysfunction by protein kinesis and phosphatases, suppression of insulin receptor substrate 1 and 2 gene expression and function, obesity, lipid and glucose toxicity. Next, the physiopathology includes genetic and acquired factors. Obesity is related to a variety of chronic disease, where the non-esterified fatty acids levels are high. These have been shown to be an important contributor to insulin resistance by blocking insulin receptor substrate 1. Consequently, it inhibits the glucose uptake.
Insulin resistance, insulin increases glucose uptake in muscle and liver and inhibits lipolysis and hepatic gluconeogenesis, leading to an increase in circulating free fat acids that further inhibit the lipolytic effect of insulin, which causes a hyperinsulinemic state where eventually the compensation fails and insulin secretion decreases. Now, adipose tissue with adipokines as tumor necrosis factor alpha cause phosphorylation and inactivation of insulin receptors in the adipose tissue as well as in smooth muscle cells. This induction of lipolysis increases free fat acid load. Leptin is secreted by adipocytes to signal the brain for satiety. Normally, as fat cells expand, more leptin is secreted, but obese people develop leptin resistance. Growth of adipose tissue during obesity development more angiotensinogen secretion, and it leads to an increase of blood pressure and the creation of reactive oxygen species. Adiponectin is an anti-inflammatory and anti-atherogenic adipokine, and it affects underdose of leptin. An increase in adipose tissue mass correlates with reduced adiponectin and higher leptin levels. Now, the atherosclerosis is caused by oxidation of small and dense LDL product of the lipotoxicity.
Most of the disorders associated with metabolic syndrome don't have obvious signs or symptoms. One sign that is visible is the increased waist circumference. Other ones like high blood pressure, dyslipidemia, central obesity, and glucose intolerance are the typical clinical manifestations.